Good evening, everybody. My name is Dr. Frank Serio, and I would like to welcome you to our live seminar on international volunteer projects over 100 years of experience. This program is brought to you by the International College of Dentists and will feature Dr. Jack Levine and Dr. Steve Mackler, as well as me. The purpose of tonight's presentation is to have each of us reflect on our experiences in international volunteering. While the ICD and others sponsor a lot of presentations on how to do these projects, we really don't get to spend a lot of time talking about our personal journeys through these types of activities. So over the next 2 hours, the three of us will be sharing some of our thoughts, experiences, the joys, as well as some of the challenges of being involved in these kinds of projects. Again, we're sponsored by the ICD, and we will have CE credit available. The details for that will be shown on the slides at the end of the presentation. So we will be here for the next 2 hours. I want to thank particularly the folks in the ICD office, the ICD officers, particularly a good friend of mine and mentor, Dr. Ira Tatunik, who has really worked with me personally to bring the message of the ICD around the country. So without further ado, I would like to introduce our first speaker. It's Dr. Jack Levine, is a restorative dentist from New Haven, Connecticut, was a graduate of Temple University. The other side of the tracks from us, where I went to Penn, so the two of us were kind of, in those days we were dental rivals, I guess. And he began his adventure in international volunteering in 1982, actually coincidentally the same year that I did. He has served for 40 years in 11 countries. His main focuses have been on Nepal and Jamaica, and has served as the program director for the project in Haiti that Health Volunteers Overseas has had. And I hopefully will speak for a couple of minutes on the challenges of projects in some of these countries. It's not always easy, and certainly a place like Haiti has been a challenge from when actually I did one of the early site visits back in the early 1990s. Jack has been a member of the American Dental Association Global Development Group and an honored fellow in many dental societies, and is a fellow of the International College of Dentists, as all three of us are. So without further ado, let me turn it over to Dr. Jack Levine.
Thank you, Frank. Thank you for that beautiful introduction. And it's an honor for me to be here with the ICD, with the fellowship, and especially to be on the program with Steve and Frank Serio. You two inspire me, have led me to all of the adventures and the volunteer work that I have done. I spent most of my dental career, strangely enough, adjusting the light. Yeah, I would put the handpiece down. I would reach up, push the light back and forth, start all over again. Put the handpiece down. I think I got it right. And then the patient moved. No, then I adjusted the light again. Each time there's been advances in lights. You can see here, this little red lanyard around my neck is the same one that I'm carrying now. Inside is what we have for light, a little flashlight that shined on our field of vision. Each new idea was a step forward to a bright and focused future. We all became fixed on the light source, and it was a bright light of illumination. It focused on our operative field. We could see one tooth at a time. We wanted to see the line angles, the grooves, the contact points, the margins. My mission in dentistry and in dental volunteering in remote areas started in places with no light at all, no handpiece, no suction, and certainly no light, just the little flashlight. I always carried a pocket flashlight to shine on our work. And here you can see me in Haiti with children. That flashlight is attached to the lanyard in my pocket. My growing steps to brightness included a series of portable lights, camping lights, headlamps, baseball caps with the lights coming out of the top of the visor, and a full mounted headlamp. I was able to get up to 300 lumens. I had a headlamp in my office. I used to carry it around. You probably have seen these, and you each have one. The cords were dangling from my waist, and I would go from room to room to plug in. Out in the field, no plugs, no electricity. All of this light that we're talking about was bright and focused light. I'd like to share with you another kind of light we call lantern light. This is the lantern. It's a different kind of light. It's the spirit of the light. We actually can see a light form in candles, a couple of candles that lit up. All of this, I want to share with you another kind of light. We just talked about that. This lantern light illuminates a wide field. It's warm, and it comes from a very loving place. The light is low, and it's not very intense. Sometimes candles are the only source of light. I can remember when I started working as a missionary and volunteer dental services in Nepal, we were working late one night, and the only light in the room was a series of candles. Candles are a symbol of ongoing hope and faith. We all recognize the Olympic candle, the flame that burns. It's a symbol of our world coming together as one. The saying, an old flame, and some of you might remember that saying, an old flame, refers to a love that continues to burn. This light in me, and the reason I continue to go forward with dental service volunteering. Volunteering, can be a life changer. Of course, for patients, because of the service we render, and it changes their lives. But the volunteering can be a life changer for the volunteer. So how can it change our lives? We give time and service without any thought of financial gain. We share our talents in surgical and restorative dentistry. We also find a group to work with, a team. We pool our skills together. We're here to help. This is what I call the doing part of altruism. Altruism is defined as a belief or the practice of disinterested and selfless concern for the well-being of others. Social scientists have studied altruism and have concluded that it has a tremendous effect on the giver. The caregivers in healthcare add to their longevity and their happiness in life. The first stage of altruism goes beyond the service, and you actually give up yourself, the self-service, and it comes from the giver's heart. It's the gradual loss of self, resulting in the gift of service. When we lose ourselves, we're true givers. There's no more ego. It's not about us. We're giving all the time here. We volunteer in remote locations, and at the end of the clinical day, we feel two feelings of emotion that come over us: exhaustion and exhilaration. there's a profound sense of well-being and fulfillment. So we're tired at the end of the day, and we get to spend some time with each other. We're proud of what we have done. One of my volunteer missions over the last 20 years has been on the island of Jamaica with a group called Great Shape International. The stories are endless. I'm just going to tell a few stories here. You get an idea of the picture of what we're doing during our day. Mary had been in pain on and off for 30 years. She was so happy with our care that she came back the next day with a wheelbarrow full of coconuts for the entire team. Joyce and Gloria are teachers in the 6th grade at a local Westmoreland elementary school. Our volunteers were at her school just the day before, teaching children toothbrushing and preventive care. The very next day, they realized how important this was, and they brought their entire families to our clinic for their first ever cleanings. I remember Jeffrey, 58-year-old man with no teeth at all, for the last 25 years. He was telling us of his sadness and his lack of eating and how he had to give up certain foods that he loved. We introduced him to our one-day denture team. Yes, you can make a denture in one day. The smile on his face after receiving dentures was one that we'll never, ever forget. He was so proud and so happy to go home. There are many stories. I remember Lisa and Paulette. These are what we call the church ladies. They were from Greentown. Our group got there early in the morning. We set up a clinic in their church, replacing the pews with portable dental chairs. Every morning before we started our clinic, we would gather together, we would hold hands, we'd sing songs, some in prayer, and we would talk about love and appreciation for one another. What a way to jumpstart the day. This was magnificent. The stories go on and on. The stories are endless. Fulfillment and sheer joy come in multiple ways to the volunteer. A simple smile, a hug from a person in a world we might be viewing for the first time. We might go back several times and meet friends. These are tokens of extreme gratitude from people who have very little. The second stage of altruism involves community. The groups we serve are people of all ages, some employed, some unemployed. And we treat teachers, students, pastors, nurses, farmers, and fishermen. They all have one thing in common. They're human beings with extreme dental needs. I've been very fortunate to work with some international organizations, one of which I'd like to show here. If you show the slide, next slide, please. This shows the Rotary Club. Oh, I think we're a couple of slides behind. This is the triage examination in the library at an elementary school in Kenya. Again, no light, flashlight in my right hand. Next slide. And here, working in a refugee camp in Tanzania, again with the flashlight, everybody's trying to learn over the shoulder how we can help this person. Next slide. This is back in Jamaica where we do have some electricity, a power generator, and I'm using the headlamps and loops. And the next. So I wanted to talk about the Rotary Club. The Rotary Club International, here's our entire team after a full day of work. They're pretty excited folks. They're smiling, and they come from everywhere. There's, I can see New York, Massachusetts, Seattle, Washington, Philadelphia, Colorado, California. The Rotary Club has an international division which raises money and is the local U.S. Rotary Club is matched by International Rotary Club at the site. This is Lucia, Jamaica. So the Rotary Club of Lucia, and the International Rotary Club of the sponsor get together, they double the money, and they can raise enough money to have a clinic here. Another group that I'm fond of is HVO. You heard that a little bit in the introduction. HVO stands for Health Volunteers Overseas. Their mission is to create teaching programs, not so much service programs, but as we know in the field of dentistry, we have a lot of things called over-the-shoulder teaching. So people are watching as we work. People are learning in the lecture or blackboard situation, in the classroom, and then in the clinic. The dental portion of HVO is a member organization. The American Dental Association is one of maybe 25 or 30 members of HVO. The importance in HVO is that they very carefully evaluate the site's needs and the site assessment. In other words, what does the host country really want? And how can we best serve them? A site assessment is done before any volunteer hits the ground. So we go to the site, we check it out, we find out where are our people, our volunteers going to sleep? Where do they eat? What's the local restaurant look like? Is it safe to walk the streets after dark? Is there someone to greet them? How do we get the bus driver to bring us to our clinic? Should we set up a clinic for multiple days, or is this a portable, carry your stuff in and out? So many, many, many questions about the teaching and about the service work. So that's why I like HVO, and they're really wonderful there. At the end of the day, we volunteers return to our temporary homes, our shelters, our tents, our hotels, and we compare notes. We kind of decompress. It's been a tough day. We enjoy a meal together, and we might talk about what happened today. We share stories. That's part of this group. We're grateful for our team leaders for organizing this and for making this happen. Next slide, please. Patient care exhilarates us. Here we are gathering together, having lots of fun, sharing a meal together. But the community of dental personnel really grounds us. We're tired, we're exhausted, and we still have room to care for one another. It's no wonder that dental missionary work veterans just light up. They get so excited. You could see it on their face. Whenever they speak about their experiences, they'll tell another story. There's clear joy and excitement in that person. This is the old flame that continues to burn. And that's why I keep going back to do this. I spent some time in Nepal where we hiked for 4 or 5 days just to get to a village to set up a dental clinic. What I thought was important there was when greeting someone on the trail, passing someone by in the hike, the Nepalis and our volunteers put their hands together like this, gentle bow as your hands go over your heart, and they would say namaste, namaste. Well, the word namaste means I see the light in you, and I hope that you see the light in me, because we, in fact, illuminate one another. So I thank you. That's a little story about some of my experience in different parts of the world. Is there anything in the chat? Frank, I'd be happy to answer some questions.
Yeah, if anybody has any questions for Dr. Levine, if you would please send them to the chat room. I'm the one who can see it. At this point, I see nothing. So I think we'll come back. We can revisit things if people have questions later on. If we could, though, we can move on to Dr. Mackler and Kylie, if you can do whatever magic you need. Thank you very much. Okay, so Dr. Steve Mackler, we could spend the next 45 minutes introducing him. So we will not do that so that he can tell his story. The three things he would like me to highlight is: one, he is a first generation American. Number two is that he loves to ride his road bike. And I can tell you that he has done that all over the world. And number three, that dentistry is his passion. I will add a couple of things to that. Steve's middle name is not B, it should be C, standing for community service. Steve has done a lot of work in whatever community he has lived in. And whether it's professional in periodontics or community where he's lived in Greensboro, North Carolina, working with international communities all over the place, which he'll talk about for the next little while. But Steve and I go back to the early 90s together when we were both at a training course for international volunteers that was put on by the University of Arizona Medical School. And we have been fast friends for the last 30 some odd years. So without further ado, let me introduce my good friend, Dr. Steve Mackler.
Are we here?
You're on, Steve.
Okay. Well, Frank, Jack, thank you. First of all, I'd like to thank the International College of Dentists for this opportunity to share my journey of international volunteering. These experiences have enriched my life by expanding my knowledge of the culture and history of each country where I've volunteered and allowed me to form many lasting friendships. The journey unknowingly brought me full circle to a small village of my paternal grandparents and father. Slide, please. While attending the 1990 annual ADA meeting in Boston, Dr. Robert Kriegsman, my sidekick in all these missions, and I visited the Health Volunteer Overseas booth, and we learned about international volunteer opportunities. Well, we signed up for the beginner's volunteer course at the University of Arizona School of Medicine and a follow-up course at the ADA headquarters in Chicago. Great courses and terrific speakers. And here you see Dr. Frank Serio was then and continues to be a mentor for international volunteering. Just observe that enthusiasm, and it's still here today. Special recognition and thanks go to Helen McCherrett of the ADA, now retired, and Nancy Kelly, the Executive Director of Health Volunteers Overseas. Also want to recognize Dr. Robert Kriegsman and Dr. Burton Horwitz, my sidekicks in these journeys. Next slide, please. Our initial volunteer experience was Fundaco Esperanza, Foundation Hope, 800 miles up the Amazon River in Santarém, Brazil. We volunteered for 1 month. The clinic was modern, proper equipment, well organized. There were multiple medical specialties, so this was not the end of the world. A previous ICD member and Rotarian was instrumental in securing much of their equipment. Most of the patients were children, a very high caries index, great patients. On the lower right, you see a young girl who would return every day after school was out to help us be a dental assistant and calm the other children and interpret for us if they needed that interpretation. Next slide, please. After clinic hours, Monday, Wednesday, and Friday, Dr. Kriegsman and I presented educational lectures to approximately 15 community dentists and our staff. The upper left we have a young woman from Sweden whose father was a dentist at this clinic some years ago and came back to visit, and she was recruited as our translator from English into Portuguese. In the upper right, we've given a lecture, and now we have one of the local dentists trying to do the procedure that we talked about. In the lower right, after the month, we gave certificates for continuing education. I can tell you the dentists were very interactive, and they really appreciated the time we spent, and they came after their busy day, just like we did, to attend these lectures. On the lower right, my colleague, Dr. Kriesman, was a Rotarian, and he said, "Steve, let's go to a meeting." So we went to this meeting in Portuguese, and it was translated for me. And I learned at that time all the things that Rotary International did on an international basis. So that was the seed in my mind to come back home and ask to join a local Rotary club and beginning of my Rotary journey. Next slide, please. Well, after 3 years of 1 month each in the jungles of Brazil, we decided we needed to do something different. And a Rotarian from Cochabamba, Bolivia, had contacted us and said, "You guys are not too far away in Brazil. Would you please come to Cochabamba and help us do a site visit and a needs assessment to look for the dental needs of street children?" And we said, "Well, okay." So we extended another week, and we flew to Cochabamba. We got off the airplane, and immediately we knew there was some miscommunication, because the Rotarians that met us said, "Where is your dental equipment?" Well, we found out that the Rotary Club that had invited us had decided that the junior Rotary Club didn't have enough to do. So they gave Dr. Kriesman and myself over to the young club, but did not tell them why we were coming. They thought we were coming to provide care. So in the upper right, you see our waiting room the first day. They had given dental appointments, one every 15 minutes, to street children. Well, in volunteering, as everybody knows, you have to be flexible. Well, here we are flexing an OBGYN chair into a dental chair, nailing a light on the wall, and our wives, who accompanied us the last week of our trip, were recording our examination data. On the lower right, the local Rotarians were able to find a dentist who would open their office. So when we would triage the children and the ones with the most acute needs, we would send to this office where Dr. Kriesman and the dentist would be there. And we also established a relationship with the local dental school, and we would send patients there. Next slide, please. Here you see a typical family, 4 kids. We would counsel the mother or the father as far as what the needs that we found in the children, and we would tell them where they might go to find some dental care, whether it would be the clinic at the dental school. We weren't sure. And we gave everybody, of course, toothbrushes and educational pamphlets. And in order to say thank you to the dental school, Dr. Kriesman and I were asked if we would give a presentation there, which we did. In the lower right is part of the physical space that the Rotary Club used. It was unoccupied, and they said, "Could you help us design a dental clinic? Since you examined 100 and some kids and you found rampant caries and need for dental care, we would like to try and build a small dental clinic." So we said, sure. We came back to Greensboro, North Carolina. We had a dental supply company design a space. And being a Rotarian, and Rotarians like to have projects, we went around to the local Rotary clubs, gave presentations, and we raised about $10,000. We wrote a grant. It was approved. Then we had a conflict. The older Rotary Club, all of a sudden, they wanted to get credit for this clinic that the younger Rotary Club wanted to build, and they could not or would not agree to sign the grant. So we couldn't give them the money. So we put $10,000 in the bank and just trying to, hopefully they would decide what they wanted to do. Next slide, please. Well, I have a friend who is in the diplomatic corps, was stationed in Harare, Zimbabwe, and said, Steve, there's a huge need for dental care. The millions of people in the country, there were only 33 dentists. And we said, well, okay, we'll go and we'll see what we can do. So we contacted the ADA and HVO, and we said, do you think this might be a place where a new volunteer site can be established? And they said, well, we're not sure. Why don't you go and do a site visit and a needs assessment? So Dr. Eric Spahn and I went. We filled out 30 pages or so of data that was requested. We came back, and it was decided that this would meet the criteria for a new HVO ADA volunteer site. So we went back a couple of months later, and they have a school of dental therapy and dental technology where they train young men and women for 2 years. They have to work under the direct supervision of a dentist. So in the upper right, we're supervising a clinical patient. In the lower left, I'm working with an instructor at the School of Dental Therapy, explaining here are the things that I feel qualified and Dr. Kriegsman feels qualified to talk to. Would that be appropriate for the students? And she said yes. And on the lower right is a very interesting dentist from the Netherlands, Dr. Jo Franken. You may or may not recognize that name, but he is the originator of the ART technique, atraumatic restorative therapy. I had never heard of it. We went with him to a small village where 3 years before he had taken hand instruments without anesthetic, excavated all the caries that he could, and put in Fuji 9. And here we were looking at the results 3 years later, and they were just astonishing how the decay had been arrested. And I think now this ART technique has been adopted by the World Health Organization as being taught all over the world. It was unbelievable. One other side story about flexibility. In Zimbabwe, in the clinic, the hours were from like 9 until 12, from 1 until 4:30. Well, at 10:15 in the morning, all of a sudden, everything comes to a stop. It is low T. I said, what in the world is this? Anyway, so we had low T in the morning. In the afternoon, everything came to a stop, and we had high T. And the clinical professor said, Steve, here's a teapot. You go sit in that room until I call you. Next slide, please. So before we get to the next slide, the HVO ADO site in Zimbabwe did become a volunteer site for dentists across the United States. And I was in charge of being the site director for a couple of years. And this went just fine until the political situation got so bad that it was determined that the ADA could not, in good conscience, send volunteers there. So the site closed. Here we are reading a Rotarian booklet where they advertise for engineers, for teachers, for healthcare people. And this is Bangalapara, Bangladesh, in the middle of nowhere, about 6 hours by boat from Dhaka. And so we decided, okay, we're going to try to go. This little village that we lived in is surrounded by rice paddies. It was just beautiful. There were 1,000 people there. 60% or 70% Muslim, and 30% Hindu, and two fellows from Greensboro, North Carolina. The upper right is a little hut that we lived in. It was clean, it was nice. In the lower left is how our food was prepared with earthen ovens. And on the lower right is our medical dental boat funded by Rotary International. It's a 96-foot boat. It had a medical clinic, a pharmacy, and a dental clinic. Next slide, please. On the upper left is a typical waiting room, what we would see every morning. The night before, they would send a runner to different parts of the island saying, the medical boat is going to be there. And these people showed up. I have never seen as much disease in my life as I saw in that 1 month where we were there. The people were lovely, but it was really something. Here's Dr. Kriegsman with his HVO shirt on. We did mainly exodontia, restorative. They had a terrible issue with thermal sensitivity and abrasion because their oral hygiene practices were to take their finger into the river and get some mud and use that as an abrasive, and that's how they would clean their teeth. And you can imagine how sensitive they were. On the lower left, we had visited an elementary school and had talked about oral hygiene and given toothbrushes and toothpaste, et cetera, et cetera. And we also held a couple of meetings with the local teachers. And we distributed information that we thought from a visual standpoint they could use to talk about oral hygiene. In the lower right was a ceremony the last day we were there. All the villagers turned out. They read poems, they sang, they danced. It was really heartfelt. I think it was terrific. So right after this, when our emotions were high, the village elder came to us and said, I would like to donate some land that I own here. If you can help me go back and raise money for a healthcare clinic. And right away I said, boy, oh no, this is going to be another Bolivian escapade. We're going to go and do all this work and what's going to happen? And I said, well, we'll think about it. Well, next slide, please. Well, go back to the previous slide. So I'm thinking about it, and we returned from Bangladesh, and about 2 months later, I get a phone call from a district governor of Rotary, and that's a hotshot in Rotary, and his wife was a nurse practitioner, and they had succeeded us on the island of Bangalapara for a month. And here again, the village elder said, I'd like to build a clinic. So the Rotary governor calls me and he said, Steve, I'd like to build a clinic. What do you think? I said, I've got $10,000 in the bank, just don't know what to do with it. You can have it. And as Jack said, how Rotary works, you can write grants and they're different levels and they're matched at different levels. So this Rotary governor solicited many different clubs, and they may have raised about $50,000 or $60,000 at the bottom level, which was doubled to then $100,000, which was then doubled at the international level. So now, about 21 years later, there is a healthcare clinic built by Rotary on this little island, which is self-sustaining, self-sufficient. Next slide, please. An ophthalmologist from Atlanta got my name from a friend and said, I know that you are interested in international dental work. I have an NGO that I've started in Bucharest, Romania. Would you come with me and help me decide what we can do from a dental standpoint? So we said, okay, we tried. And upper left is a local older dentist. And we talked, we brought some supplies for him. we got all the information, and we were going to follow up with him and see if we could recruit other people to come. Here's the ophthalmologist in the upper right doing exams. This was an unbelievable experience for me because most of the people that the ophthalmologist saw were elderly and were completely blind because of cataracts. And within a half an hour in surgery, they could remove the cataracts, put in a lens, and these people could see again. And just the emotion of these people who were blind and then they could see was just unbelievable. Well, the ophthalmologist had also been a volunteer in a country called Moldova. And he said, Steve, I have donated a surgical microscope there. It's malfunctioning. I need to go visit for a day or so. Would you come with me? And I said, sure. Where is Moldova? I'd never heard of it before. Well, in the lower left, you can see a map of Moldova, which was an artificially created country during the Second World War. At that time, the German Foreign Minister von Ribbentrop had bribed Stalin not to enter the Second World War by giving him Latvia, Lithuania, and Estonia. And then he took a third of Romania and gave it to the Russians. Well, 6 months later, Stalin entered the war against Russia, but Moldova was created and it was a USSR country up until 1986. So we went to Moldova, and the people are unbelievably hospitable. So at 9 o'clock in the morning, meeting with the heads of the hospital, you have to toast cognac and more toast and more toast. And the fellow with the top hat is not a culinary worker. He's the head surgeon in the hospital. And his status is by how tall the hat is that he wears. Next slide, please. So when we visited the hospitals in Moldova, we knew that Chernobyl had occurred about 5 years previously, and there was a tremendous incidence of cancer, especially pediatric cancers. And I asked around, and there's no such thing as hospice care. And I thought this would be a great place for a Rotary Club to build a hospice, because a Rotary Club in our town of Greensboro 6 years earlier had raised funds and built the first hospice ever in the former Soviet Union. I said, well, we could do this again. So I came back to Greensboro and I called my friend who was in charge of hospice and also a Rotarian. And I said, I know where we can build another hospice, but you've never heard of it. Where is it, Steve? And I said, Moldova. And she said, not only have I heard of it, but my colleague has adopted a child from Moldova. And did you know that the state of North Carolina has an official relationship with the Republic of Moldova, sort of like a sister city relationship? And I said, no, I had no idea. Let's look into it. So we met with the Secretary of State of North Carolina and the military folks, and we determined that the state partnership program, it's a Department of Defense program and a State Department program where every state in the United States is partnered with one or more countries around the world. You can Google the State Partnership Program and find out who your state is linked with and see if there's any relationships that you might become involved in. So 4 people from North Carolina, the head of the North Carolina Department of Dental Public Health, the medical provost of the University of North Carolina, Dr. Kriegsman and myself went back to Moldova about 4 months later, and we met with the Moldovan Minister of Health, the medical provost, the dean of the dental school, and other professors, and saying, you know, what are your needs? What, under this relationship, how would you like to see it developed? And before I know it, they had all these papers on the table wanting me to sign a memorandum of understanding. And I said, well, I'm not, I'm nobody in North Carolina. I don't sign anything like this. So we took all the papers. We came back to North Carolina. We gave them to the legal people, and they said, fine, we can do this. Next slide, please. So what we did is we started a relationship between the School of Dentistry in Chapel Hill and the School of Dentistry in Kishinev, Moldova. And this relationship means that we were going to send volunteers to Moldova to teach at the dental school and to treat where necessary, and bring Moldovan dental school professors to Chapel Hill. So our first year back, this is our portable dental equipment that was Army surplus, and we went to a small village, not a small village, the second largest town in Moldova, about 2 hours from the capital. We took Moldovan dental residents with us to act as translators, and we took turns treating these patients. And it was tough, but we were able to do it. After doing this for a couple of years, I asked a colleague of mine who worked with Samaritan's Purse in North Carolina, I said, I'd like to go to a real isolated orphanage. We've been working in what we call show orphanages, where the kids seem to be well clothed, everything seemed to be okay. And he said, well, fine, you're going to have to go with me a couple hours into the country. So we loaded up the SUV and we rode, and here we are unloading the boxes of shoes so the kids could try on. And here you see them trying them on, a couple shoes too big so they can grow into them. And we came back to North Carolina. Next slide, please. And I get a phone call from a dentist in South Carolina. He said, my office copy machine has caught on fire, smoke damage. The insurance company is going to give us brand new equipment. I know you do volunteer work. Would you like some dental chairs and ADEC carts? And unknowingly what it would be, we said, well, sure. So money to haul it up to Greensboro, money to store it. And then we looked, and boy, it needed to be cleaned. So we just opened the phone book and put our finger on after disaster. If you have smoke or water damage, these are the people that you call. So we called him up, told him the story. He called us back and said, it's going to cost you a couple $1,000s to have this clean. And we said, well, fine. This is not for us. We're going to clean this up and ship it to Moldova to be used in some orphanages. And he said, Moldova? I said, yeah. Have you heard of Moldova? He said, well, 3 or 4 months ago, I went around to all the Kmarts and Gmarts and Sears in Greensboro, and I collected all their odd size unsold shoes and shipped them to Franklin Graham's Samaritan's Purse. And I said, wait a minute, let me look at the pictures that I have. And there on the box, the pictures were Greensboro, Kmart, Walmart. So I sent this fellow the pictures and I said, we delivered the shoes that you collected. This guy was so taken back that he cleaned our equipment for nothing. And now it is shipped and it's in Moldova at orphanages. So we spent the next couple of years going to different orphanages, and then we settled on one orphanage in the capital of Moldova, Kishinev, and just here we are examining children, treating children, showing some of the residents what we're doing. And these kids, you could take them all back with you. They were all so cute. And that's Dr. Kriegsman, my colleague in crime, in the upper left there. Next slide, please. Well, not only did we bring Moldovan professors to Chapel Hill and send Chapel Hill professors to Moldova, but we started sending our dental students, our rising senior dental students, for a week during the spring break. And a typical week would be, we would leave North Carolina on a Friday afternoon. We would arrive in the capital of Moldova on Saturday afternoon, rest. Then on Sunday morning, our dental students and the professors that we took with us, or we would give lectures and presentations to the Moldovan dental faculty and dental students. And I was concerned about Sunday morning. They said, no, that's the best time to do it. And we would have 200 or 300 students and professors there. The rest of the week, on a Sunday afternoon, we would meet with our Moldovan dental students who were paired with our UNC dental students in teams. And we would decide who was going to go where during the next 4 days. And how this worked is we worked at the dental school. We worked in 2 private dental offices. There was modern equipment. And the UNC student was the operator at one time, and the Moldovan was the assistant, and then they would switch and they would learn from one another and they'd get to know one another. And it was great. And we weren't trying to see how many patients we could see. It was just trying to build some relationships. We would usually see about 130 to 150 patients a week. Next slide, please. So here we are. This is after a Sunday morning presentation. That's Dr. Burton Horwitz and Dr. Cheryl Siegel have been doing this with us for about 18 years. And it's just been great. Next slide, please. So when you're in my office, if I find out that you're in the health professions, the next thing I do is ask you if you have a passport. And then the third thing I do is present my case about going to Moldova. And it seems to work. So in 2012, we recruited the first nurse who was an expert in PICC line placements. A PICC line is what you might use in this country for chemotherapy. That concept was just foreign in Moldova. So she agreed to go back and work with work with the oncology patients and teach. And we also recruited an interventional radiologist because we weren't sure if the Moldovan physicians would listen to a woman, to a nurse, and they did. He didn't have to say a thing. Next slide, please. So this one nurse in 2012 has developed into 18 different nursing educators, 4 schools of nursing, 2 hospital systems, and the Guilford County Public Health System. And Moldova nursing education is divided into 5 regional nursing colleges, which is like a 2-year program, and it's minimal education as far as Western standards. So for the past 7 years, our nursing collaborative has gone to Moldova every summer and spent time sharing educational curriculums, educational materials, best practices. You can read those slides and sort of pick the different topics that they were interested in, such as oncology, mental health, geriatrics. Next slide, please. The other interesting thing that we did, and you may want to try this in your dental office, is hand hygiene program. You know that you teach people how to clean their hands, and you're not quite sure if they know how to do it. Well, we used the train the trainer model, and we used a chemical called glow germ. It can be a particle, it can be a gel, it can be a solution. You put this on your hands, and then you go and you wash your hands as good as you can. And then you use ultraviolet light, and it'll show you where you missed. Well, we had to find out where to get this glow germ from. And there's a company in Utah, and we called and we told them what we were doing. This was a Rotary project. And it just so happens the owner of Glow Gem is a Rotarian. He donated all the equipment and supplies for the next 3 years of this educational initiative. Next slide, please. So let me get on the right slide here now. So as far as why do you raise the status of nursing in Moldova, the nurses are just the key to the healthcare system. And if you empower the nurses, it can improve gender equality and build a stronger economy. And the World Health Organization's focus is nursing is central to health promotion efforts that contribute to a healthy workforce and an economic prosperity. Next slide, please. Now, the title of my talk this evening was Networking and Collaboration. And here's just one example under the North Carolina-Moldova partnership where Rotary is involved, hospice is involved. We were able to recruit all 4 medical schools in North Carolina, the School of Public Health, of course, the School of Dentistry, and the School of Pharmacy. And they all have memorandums of understanding with exchange programs for faculty and students. And it's a fabulous program, and it's been terrific. The latest thing that we're really proud of is, I mentioned Rotary throughout this, but up till last year, we had written about 6 Rotary grants. For you Rotarians, they're district grants and global grants to the tune of about $200,000. We have just been approved for another grant for $200,000 to continue this nursing collaborative to 2024. And part of that is this relationship between North Carolina and Moldova and the nurses. The medical university in Moldova asked our nurses to help them organize and build the curriculum for a 4-year BSN program in nursing education. And I'm pleased to say that that has been done. And the first graduate, there are 20 students in a class, the first graduate will graduate this coming May. Now, there are 2 problems with doing this. One is they're going to be highly trained nurses, and how do you keep them in Moldova if they're not paid well? So the Moldovan folks are working on that. That's their challenge. The other challenge is how to change the culture of the medical community in Moldova so that they can appreciate the value of a highly trained nurse, how it can make the physician's life easier, and how they can provide better care for more people. So this is really exciting. Next slide, please. All right, here's the summary. Why do I volunteer? Well, it increases my knowledge as a global citizen. I've always enjoyed teaching and sharing my experiences. The most rewarding thing is to act as a change agent for fellow professionals and watch that little light bulb come on in their head when they get it. And I recognize my obligation to try and make this world a better place. I did a little research, and there's a Babylonian Talmud from the 5th century. That's a body of Jewish law. And I want to quote, "One who causes others to perform mitzvot, which are good deeds, is greater than one who merely acts." What have I learned? I've learned that volunteering requires an inquisitive mind, passion, collaboration to build personal and institutional trust, and a lot of educational training. If I had to do it over again, I would start earlier in my career. The future of volunteering, and Jack has referred to this, but next slide. There is a new declaration called the Brochure Declaration, and it talks about building mutual partnerships with bidirectional input and learning. Bidirectional is the key. empowered the host country and community to define their needs. And we've pretty much done that with site visits and needs assessment. These programs need to be sustainable and hopefully building capacity. Of course, you need to be compliant with laws, ethical standards, and codes of conduct, humility, cultural sensitivity, and respect for all involved. Finally, I just want to thank everybody with the International College of Dentists, the ADA, and health volunteers overseas for allowing me to participate in their programs and to enjoy this journey. And thank you. I got off my script.
All right, Dr. Mackler, thank you very much for all of your comments, your stories. I think one thing anybody who's involved in these types of international activities can say is that we all share very common experiences. While one time we may be on a boat on the Amazon in Bangladesh, another time in Haiti, another time in the Dominican Republic, there are a lot of commonalities in all of these projects. And I think a couple of points I just want to highlight, and then we have to go to a couple of questions. First point is that I think, Steve, when you were talking about how the cleaning company decided to, I don't believe in coincidence in life at all. I think it's preparation meeting opportunity is what it really is. And people want to be involved in these types of projects. And whether you have it as part of your practice or whether you're just talking to somebody and say, hey, wow, that's great. That's something we just did. We just collected all these shoes for Franklin Graham to send to Moldova, and then they did your stuff for free. In the past, we had a lot of our stuff shipped for free that otherwise would never happen. But I think people want to be part of these projects. I think everybody out there, I think you need, as you get involved in these, put that lantern on top of the bushel basket. Let the light shine. Jack talked about shining the light into the darkness. And I think we need to do that. And all of us, we could spend the rest of the night telling stories about how people have stepped up to help us. So I want to thank both of you for your presentations. Yes, go ahead.
The two things that I forgot to mention. One is the original content about building a hospice in Moldova. We came back, we wrote a Rotary grant. It was funded, and Rotary said, we don't have enough money. So an anonymous donor in one of our clubs put up $60,000 21 years ago, and this hospice has been going for 21 years. And the second thing I forgot to mention is the third year I was in Moldova, I asked one of my last surviving relatives where in Romania my father and grandfather immigrated from. And it turned out I was working in a town about 20 miles from the village where they came from.
Wow, that is just great. So I want to move on to a couple of questions that I think are general questions for the group. And this is a question that comes up a lot, and I think all three of us can talk about this for a second. What advice can you give to a dentist who wants to experience remote dental volunteerism, but is intimidated by their inexperience? We'll get to that. Somebody just asked about repeating the saying. We'll get to that in just a minute. What can you do? One of the things I think that ICD has been trying to do is give people an idea how to get involved in these projects. I will be at the Greater New York meeting Thanksgiving weekend talking about how to get involved in projects. I'll be at the Chicago Midwinter meeting in February doing the same thing. So all three of us have gone around doing these, and guys like T-Bob Davis and others have gone around talking about how to get involved. But one thing I will tell you, you want to network, whether you talk to one of us or whether you talk to, there's some information on the ICD website. There is a website. I'm sorry I don't have the slide. I don't have it in my presentation either, but I'm going to give you a website right now. So all of you who are interested, write this down, please. It's adafoundation.org. adafoundation.org/international volunteer. No space for international volunteer. Again, it's adafoundation.org/international volunteer. Now that website will show several things. Number one, it has a pamphlet that many of us have contributed to that talks about how to get involved and run international volunteer projects. Number two, it has a directory of organizations that are looking for volunteers. And while Steve was talking, I was not paying attention. Steve, I'm sorry, but I was texting with Brianna to see when it was last updated. And that the directory is updated every January and was updated in January of 2021, even with all this COVID stuff going on. And I'll talk about COVID a little bit at the end of my presentation. But anyway, so that's part of it. This is the thing. For those of you who don't know where to start, I talk about jumping off the cliff and landing softly. There are so many people out there now who have done this and are willing to share. All I can tell you is get hooked into an organization that does this, that goes someplace you want to go, that does the type of project you want to do, that whether it supports a church mission or a secular, whatever, it doesn't friggin' matter. Do whatever, whichever way you want it. But that is one place to start. The other thing you do is you talk to us, and our emails are out there. Just tell us who you are and how you know about it, just so we have some frame of reference. But anyway, would either of you guys like to add anything to that?
I think it's great. If it wasn't for you, Frank, I wouldn't have been doing this.
So,
my tribute is to you as well, Frank. But I think the question says, here's an inexperienced dentist who's concerned about his own talent. I think what you answered was the group you choose to go with is the key. Go with a group that's got long-term leadership, that returns to the same place every time, that maybe has a clinic or portable clinic. Keep asking until you find the comfort level. It's not about the technique or the procedure or the tooth care or gum care. It's about the experience of volunteering.
That's correct. And I think that's part of the comfort level. You can do whatever, you can do most of what you do at home in other places. I'm going to talk a little bit about that in a couple of minutes. But I think Jack is right. Find your comfort level. Find a group and make sure you understand, because people get involved in groups that they're not really sure about what they're all about, and then they find they have a lousy experience, and then they're turned off by it. But so it helps to do a little bit of homework. Steve, the quote you had from the Talmud, the 5th century Talmud,
is from the 5th century.
Yeah,
Babylonian Talmud.
If you could repeat that, please.
Okay, the quote is, "One who causes others to perform mitzvot or good deeds is greater than one who merely acts."
Okay. All right. Thank you. Whoever had asked that. One other person mentioned one organization that I know is in the directory, but people may be familiar with Remote Area Medical. That's an organization, ramusa.org. I've done a bunch of projects with them over the years. They do a lot of work with Mission of Mercy in the state of Virginia, but ramusa.org, go to that website. They do a lot of work in the United States. And remember, you don't have to go someplace else to do this stuff. There is plenty of things that you can do here. And I just want to say to both the presenters that you are getting lots of, I don't know if you guys can see the chat room, but you are getting lots of positive compliments. So, felicidades to you both, and to use my best Spanish, or mazel tov, or whichever language, whichever culture we choose to use. Anyway, so I think that covers one other thing. Now, this is a very important question. What action, and this is for all three of us, what action do you take in a remote site if you encounter a patient with a life-threatening condition?
I try to find the best nearest resource to connect them with, and that's all I can do.
And that, and I would basically agree with that. Jack, you want to add anything there?
I think he's muted.
Jack, turn on your mic, please.
The distinguishing factor is whether we have an emergency acute situation or whether we have a diagnosis that may lead to more trouble later on. I think all of our dental missions have a medical component or a medical liaison or a hospital relationship. The leaders of the organization will make those connections and make transportation available. I think it's important to have, it's a tough one, tough question, but to have safety and emergency for the volunteers as well as every patient that comes in.
I think that's true. And I would just want to add to that, what we had to do a bunch of years ago with HIV being prominent, particularly in the Caribbean, on the island of Hispaniola, we would take OraQuick, which is a diagnostic, HIV diagnostic thing. Plus, we would take a month's worth of antiretrovirals with us, which the first time I bought them, they were very expensive. There were several thousands of dollars for just 1 month's worth of medication. I bought them recently for this year. It's all generic now, so it's a few $100. So it's gone. Remember, Jack, you and I talked about that a bunch of, a while ago. And so there, we as group leaders, if you are the leader of the group, and again, for those of you volunteers, you need to talk to not just the leader, but other people who have volunteered. Our job, primary job, is get everybody home safe and sound. That is job number 1, job number 2, and job number 3. That is our job as the project director. Nothing else matters if you don't get your people home safe and sound. And sometimes you may have to change the project because of what the situation on the ground is. And so just be aware that, yes, you can do all kinds of stuff, but if somebody has a problem, that's why we insist that all of our volunteers have international medical evacuation insurance. Everybody has to have medevac insurance because my project cannot afford to spend $20,000, $30,000, $40,000 for an individual who has problems. They have to do that, they'll have to do that themselves. Plus, we insist that everybody has international health insurance because the health insurance you have here is not necessarily going to pay internationally. And there's a group called Gallagher Charitable. Travel with Gallagher is the website that has both international health insurance as well as medevac insurance as well as malpractice insurance. And so that is just something to keep in mind. But as we work on these projects, you try to know where the places, where the hospitals are, where the major centers are. But sometimes if you're working very remotely, it really creates, like at Haiti, I mean, what are you going to do? I mean, it really creates problems because there is no infrastructure even in Port-au-Prince. So, it is a problem. And the other thing is, I hate to say this, but sometimes we just can't do anything. And that for Americans particularly, that is probably the worst feeling, that there's just nothing that you can do in the scope of what you have, or even, what's possible down the road. Okay. All right. We're going to switch gears if that's okay. And I am going to spend a little bit of time. Okay, we're going to shared screen, and I think we're okay, right? So what I'm going to do is just spend a little bit of time talking about the evolution of my experiences. Jack spent time talking about it from a philosophical standpoint. About coming into the light. Steve talked a lot about various projects, and I'm going to try to kind of pull a little bit of that together. And so, the three of us had, I think, 111 or 112 years of experience. And again, I want to thank the ICD for allowing us to do this. And you guys all know who I am. That just gives you a little bit of background. I've been probably, among the three of us, been probably the most visible around the country the last 20 years. So, we've talked, let me just look at my notes just for a second here, see if there's anything else that I want to mention. Yeah, one thing I just want to say, going back to what Steve said. One of the things that Steve said was that he wished he had started earlier in his career. Many of you, if you're a fellow, you're in mid-career usually by this time. I was very fortunate, luck would have it. I went on my first trip 2 years out of dental school, and it just worked out that the good Lord, I call it the unseen hand, guided me in the right place, and that really started me on an odyssey that changed my life completely. As I said previously, coincidences do not exist. That people certainly you talk to people and things happen. You say, "Oh, it's a coincidence." No, it's not a coincidence. You put that light on top of the bushel basket. I love Jack's story about the coconuts. Because one of the things that I learned, and we all learn lessons, whether they're cultural lessons or dental lessons or anything else. At one point, somebody thanked us by giving us a chicken, a live chicken. And you shake your head and you go, I know these people haven't eaten meat in a month, and they're giving me or us a chicken. What do? We take it and say thank you. You have no other choice. And I have made the other choice. And the dignity of somebody sacrificing for you to thank you for sacrificing for them must be maintained. And so that is, to me, a very important thing. That was very much a lesson learned early on. And Jack, talked about getting the coconuts or other things. It's really important for those people to say thank you. It is absolutely important for that to happen. And as he mentioned, the light, however it shows up, is there. And just be prepared for it. One thing Jack, showed his flashlights. We carry flashlights all the time, even though now electricity is not as big a problem in the Dominican as it used to be. Still, I just put a mag light in my pocket every night when I go walking around, just in case the lights go out. Best part about the lights going out is you can see the Milky Way. It is just spectacular. The heavens are just spectacular. So you take advantage of whatever situation comes to you. I want to make a few personal comments. And I think the other two had mentioned it, but I think words of gratitude are really important. I first want to thank my parents who instilled in me the idea of service. For Steve, it was very important for him to find out where his folks came from. My dad, I come from a family of 12 kids, as some of you know, and my dad was a dentist and talked about doing mission projects even back in the 60s and 70s. So I had heard about this. These types of things for a long time. He never went. I think part of it was just not knowing what he was getting into, but also when you got 12 kids and you're worried about, if something would happen to him, what's going to happen to all the kids. But I grew up on tall shoulders, certainly, and both my parents. My mother was a very spiritual woman and a woman of great service. I want to also mention, for some of you ICD members know Bob Seminara. And I didn't know Bob until I went to my first grade in New York meeting probably about 10 years ago. And he came up to me and shook my hand and hugged me and goes, "I love your dad," because my dad was Bob's mentor and basically encouraged Bob to go into dentistry, and of which he's had a great career. And those of you from the New York area and part of the greater New York meeting, as well as ICD, know Bob. I also want to thank my wife, who's also a dentist and both has been on the trip a bunch of times, but also the time she hasn't gone. Remember that, your spouse may stay behind, but somebody's running the show while you're out running around saving the world. And so just realize that you're not doing this yourself, that you've got family, and our son Andrew and our daughter Grace have also been on these projects. I also have to thank the thousands of participants and supporters of the projects. None of us do this ourselves. And for those of you who may not have done this, you say, well, how? it doesn't just happen. Nothing just happens. But I firmly believe that the good Lord helps those who help themselves. And you will find that there will be plenty of support. There will be plenty of people to pull the wagon with you as you get involved in these projects. Also, as I mentioned, I want to thank both Doctors Levine and Mackler for being part of this presentation tonight. Dr. Tatunik, who has really, over the last 10 years, become a very good friend of mine and has been my one of my godfather at the Greater New York meeting. And again, also everybody else who has made this go. I think the ICD has really come a long way in the past few years, getting the word out for this kind of activity, is really taking this on as one of its major projects, whether it's committee work or supporting presentations or this type of thing. So thanks to all of you guys. Why do we do what we do? I think for those of you who are old enough to remember Talking Heads, the question is, well, how did I get here? And certainly that's something we all ask. And I think both of the previous presenters answered the question, why do we do what we do? And I can tell you, similar, I think, to what Steve mentioned towards the end of his comments, was that I do what I do so that when I leave this earth, I can say that I left the place a little better than I found it. Simple as that. It's very simple. You look at it depending on what your motivation is, whether it's spiritual, theological, temporal motivate, whatever it is. We all do it for personal reasons, but many of those reasons certainly overlap. And my odyssey, my 40-year odyssey, I went to the Dominican Republic in 1982, out of dental school, 2 years. I had a friend of mine who had she was in med school in the 70s and had spent one of those semesters in Kenya before she graduated from dental school, from medical school. And I had hoped, I called the Catholic Medical Mission Board and said, can I go to Africa? Can I volunteer in Africa? And they said, great, can you go for 2 years? And when I stopped laughing, I said, okay, where can I go for a month? And they made some inquiries. Remember, this is 1982. We're talking about snail mail, not email. And it took several months for things to happen. And I eventually ended up with a group of Catholic nuns in the Dominican Republic. And so the fact that I did that, went for a month by myself, the person who asked that question, I had no idea what I was doing, zero. And there wasn't anybody to even ask what to do in those days. But I went basically outside my comfort zone, and it turned out to be one of the 3 or 4 best things that's ever happened to me in my life. So I did that for several years. I went back to the University of Maryland where I was teaching, talked to a group of students who said, hey, can we go on this trip? I said, I don't know, let me find out. And so I asked, and people said yes. And literally that's how the project got started. And so we've been going now, this will be our 39th year doing this. We're going actually next week, a week from Friday. We're going, it's going to be a little different, and we'll talk about dealing with COVID in a couple of minutes, but we're heading back because we missed 2020, and 2021 we got canceled in the summer. So we're going now. And then Helen Cherrett, who Steve also mentioned, they were starting the Dentistry Overseas Steering Committee back in 1990, and they were looking for a young dentist who had international volunteer experience. And in those days, there weren't too many of us, and somehow or other, they found me. And then I ended up being involved with the ADA and have been one way or another ever since. As Jack mentioned, HVO is great. You have to do a site visit before you go, and I've done several site visits along the way, as well as a project in Vietnam, did some ADA projects in Guyana, and the ADA International Symposium that had gone on every other year for a long time. And that's where Dr. Mackler and I spent a lot of time together, as well as, and he had spoken at and being a participant. And also I've lectured for all these guys. And some of these are sponsors of some of the co-sponsors with the ICD. But I mentioned the Greater New York meeting. I also mentioned the Chicago Midwinter. But there are a lot of people now, a lot of organizations that really support this kind of thing. So the underlying principles, making the world a little better for having been here. That is my underlying principle. And Steve mentioned the brochure declaration principles, and I don't have to read them again, but it just gives you an idea. But basically, and I've said this in different words over the years, that it is important that projects are we projects, not us and them projects. And sometimes they are us and them projects, which create some difficulties, but having we projects. And I learned this the hard way because, of course, I have much more humility now than I did in the early years of this project. And we don't have all night for me to tell stories, but the reality was I thought I knew more than the locals did. And Father Lou Quinn very quickly straightened me out. Let's put it that way. And so that was the thing. And so the partnerships are mutual. And I say that Dominicans are as important to our project as we are to them. Without them, we can't do it. Without us, they can't do it. And so it really works that way. And we definitely are. It's up to them to define the needs and the activities. And we'll talk about the evolution of our project. And it's sustainable. A few years ago, I had a student from ASDA was interviewing me, and I think the project had been going for 35 years or so. And he goes, he had a set of questions. He goes, well, what are you going to do to make it sustainable? And I just scratched my head and I said, I don't know. After 35 years, what am I supposed to tell you? I have no, I just don't know what to say. So, that was just something to think about there. And this is important. Compliance with applicable laws, because these sovereign nations, they have their laws. You have to play by their rules. That's all there is to it. But the rules are different in the Dominican Republic than they are in Jamaica. And Jack knows a lot about Jamaica and all the things you have to do to make a go of it in Jamaica. But and then the code of conduct, I like to put in the code. Who do you represent? I always tell our volunteers, you represent yourself, you represent the project, you represent the mission, you represent your dental school, that's where you came from, you represent the profession of dentistry in the United States, and you represent the United States of America. All of those things. And so you need to behave, you need to comport yourself with dignity and humility, as it says in the next one. And you have to be accountable. I tell our volunteers, you have to do as good a job here as you would do at home. And hopefully people do that. And we've been going back enough where we see some of the work we've done, and it's holding up. I mean, I'm really impressed with how people have done. What can you do? Lots of things you can do. And I think both our previous speakers have talked about breaking down barriers in both directions. And I'd say, if you're not having a good time, you're not doing it right. The only time I think, it's a lot of work. There's no question. Unfortunately, you may pick up some parasite that takes a while to get rid of, but it really that's part of what feeds us is the energy we get from doing this kind of thing. People talk about this a lot, but there's a piece of this that is missing. Teach them to fish, feed them for a lifetime if they have fishing rod, line, fishing line, at least you don't need a rod, you need a fishing line, a hook, and some bait. And part of what we do in these educational projects that are HBO type of projects or our projects is you not just give them the idea of how to fish, but you've got to give them some of the tools with which to fish. And so that's part of, talk about sustainability, leaving things behind when you're a volunteer. Some of you may remember George Gillespie, who used to be the dental director for Pan American Health Organization. When I was talking to him one day, he goes, well, what are you leaving behind, Frank? And when we told him, and then he was cool with that. But if you're just going and doing your thing and patting yourself on the back and going home and not leaving anything to help sustain the community, really, what have you accomplished? And so, projects evolve. All of them evolve. You don't want them to be one-offs because what have you really done? Yeah, you've pulled a few teeth, maybe got a few people out of pain. But as far as prevention goes, as far as other things go, what have you done if you don't evolve and you don't involve the community, you don't do those kinds of things? So that's really something that you need to think about. And this goes back to brochure, of course, but you have to reorient the paradigm, shifting your thinking to the local context. And both Jack and Steve, I can't see them, but hopefully they're nodding their heads. Yes, with this, because it's all about the local context. And I'll tell you at the beginning, yep, Steve, thank you. Steve is nodding his head. Jack hopefully is nodding his head. But yep, Jack, there, oops, he's there, he's gone. But the reality is it's their deal, not our deal. And all three of us, I think, are shaking our heads in nodding in unison. So just keep that in mind as you folks who are starting out on this. Remember, it's not about you. It's about the people we're going to serve, the communities we're going to serve, and the communities we're touching. And I just want to quickly say that, it's interesting when we travel internationally, people have ideas about the United States. Geopolitical about the United States. We're not going to get into that tonight, but many people have very different views of Americans as being very generous of spirit, generous of material, generous of all kinds of things. And so really that is something big. Dominican Dental Mission Project, we're just going to touch on this a little bit, mostly because it's the thing with which I've been involved for the longest part of my life. This should have been our 40th anniversary. It's only our 39th, but that's okay. We're going to blame it on COVID. And this is key, meeting the needs of the community. And in our case, the community, we have to go to them because our dent in the town that we stay in, that has a nice dormitory and other things and has access to transportation. They don't need us. They're a dentist in town. We are not there for the town. So we go up into the mountains all around where people will go an hour so that people 2 hours past that can come to us. And so we'll do those kinds of things. We're mobile. And this has evolved in the first few years. Back in the 80s, this evolved from the 80s. This model actually started in the 80s, but we're mobile. We do all kinds of things. And we'll talk about it in just a second. We support the local dentists, some of whom started by holding flashlights. Jack, they held flashlights for us, and they've grown up to become dentists and are back working in the community. And certainly we're very sustainable, and the needs change over time. Well, we did a lot of extractions at first, then we do a lot of restorative, now we do a lot of prevention. Now we're making those one-day dentures that I think Jack had mentioned earlier on, and it's going to be on the next slide. So there are lots of things that can happen. And again, these are what we do. I happen to work with a company called Benchmark Dentures. And I don't know who Jack's been working with, but benchmarkdenture.com, bunch of guys I met. Again, there's no coincidence in life. I went to Bluefield, Virginia for a year to try to start a dental school in Appalachia. The best things that came out of that, the school did not start, as you know, but the best things that came out of that was meeting Steve Aloof and Scott Miller, were the principals behind Benchmark Denture. And our project can make in 5 days time with a big team, 120 units of dentures in 5 days. We're not going to do that well when we go next week because there's only a few of us going. But these are the types of things we do. And we do pediatrics. We have a Dominican pediatric dentist who works with us. Pulpotomy, stainless steel crowns. We do a lot of silver diamine fluoride. We do a lot of, when we have periodontists with us, we do a lot of scaling and root planing. So this is, and we're more, remember, we travel every day to a different place. So we really do a lot of things. And I'll tell you, I've learned a lot over the years. It's evolved. There could be other things we can do. People bring things to the table that really help. And so the next few pictures, I'm just going to show you guys a few pictures over the years. Remember, the first year I went by myself, and I have no idea who this skinny guy is. I have no clue. I have not seen that guy in 30 some odd years. But these are the nuns I work with in the first place. Sister Jane, Sister Cecilia, Sister Teresa, and Sister Ruth. None of them are there anymore. Several of them have passed on, but they adopted me as their own. And this is the same order of nuns with whom I continue to work. And lots of things have come out of these projects, not just the service that we've provided, but the camaraderie. And this is my friend now, Jenny Polhouse, who was a Dominican dentist, fell in love with my American volunteers, came to Baltimore. She is now Dr. Jenny Polhouse. Her husband is Dr. Steve Polhouse. They're both dentists in Baltimore. She went to the University of Maryland to get her U.S. credentials and is now a staff dentist at the VA in Baltimore. And her husband has a private practice in Linthicum. But, they've been friends of mine for years. But they came into us because we have Dominican dental students, and Dominican dentists work with us as well. Remember, these are we projects, not us and them projects. Going to the dentist is an event, no question. I've never seen, in the United States, people fighting to get to the dentist. But there we've had to stop a few times to get crowd control before we continue to work. But this gives you an idea of the need is so great. And that's the thing about it. And that's why we missed being there the last few years. Sister Teo can't wait for us to be there because she knows about the need. And it's my friend Franklin on the left, and I can't remember who that dental student is on the right, but using Aseptico portable equipment. And this is my friend Chito Ramon Tejeda, and he's been working with us for years. He is one of the dentists who is in Ocoa, San Jose de Ocoa, and around there. And we support him any way we can. He looks at me, those of you who were at the ADA Humanitarian Award in 2015, he was one of the stars in that video where he talked about me being his dental father. And of course, it's very touching, and he's just wonderful. And I can't wait to see him next week. And we have, volunteers. This is a prosthodontist from DC, who's regular, Keith Progerman, his regular clientele of the people who literally run the United States. And then he took the time a couple of summers to come down and work with our denture group. And this gives you an idea of what the dentures look like. It's a thermoplastic denture. You basically get an impression, trim the denture back, put it in boiling water. It's thermoplastic. You can mold it to the denture, and then you do a hard reline on the patient's mouth. Principles are the same: vertical dimension, alatraga line, interpupillary line. It's all basically the same. The only nice thing about it, it's all monoplane, so the occlusion is relatively easy to work out. And that gives you an idea of what's what. Oral surgery, whatever we got. You can always tell who I am because of the hairy arms. I mean, that's generally, the shape has changed over the years, but the hairy arms have remained the same. And this is our prosthetics finishing lab. At the end of the day, this is where it takes the longest to finish the dentures, get them polished, get them fitted properly, and then deliver them to the patient. But this gives you an idea of what is possible with one of these dentures. The gentleman on the right is a fellow named Dr. Ernie Delheim, who taught me when I was in dental school at the University of Pennsylvania, and then was in private practice in the Philadelphia area for many, many years. And I happened to be in Philly a couple of weeks ago for a wedding, and had a chance to go out to lunch with Dr. Delheim and another one of my former faculty members, Dr. Frank Maressa. But this is the thing. These projects, you make lifelong friends on these projects, with Steve and Jack and Paula and everybody who's involved in these projects, with Ira, all these guys, you end up making lifelong friends. And it really is terrific. Just another example before and after of these one-day dentures. Family affair on the left. After a very hard day's work is my wife Cheryl, and on my right and on my left, on the right of the screen, is my sister Mary, who went with us a few years ago. She was a dental hygienist at first. She worked with my dad, and then went and did what she's really good at, which is music. She is a gifted musician and now teaches music to local schools. This is key. Brochure, anybody. Steve knows this. Jack knows this. Anybody who's done this more than once knows this, that collaboration with the local community is absolutely essential for success of projects. No question about it. And it's my friend, Dr. Everett Cabral, who's a local dentist in town. And there we were talking about whatever. We were planning something. I'm probably talking about dentures, I guess. But, we work hand in hand with the Dominicans, because we depend on them as much as they depend on us. This was out by the Haitian border. These were our volunteers. I will tell you, project T-shirts are worth their weight in gold. And it really gives them a sense of appreciation that we give them something. These certificates of appreciation are also, or participation, are also very nice. There's my wife. There I am in the background. The lady in red is a Dominican, but not a Dominican Republic person. She is a Dominican nun from Long Island, Sister Jane O'Reilly, who had been a missionary there for 30 years and has now retired back to Long Island. So we worked for 25 years out by the Haitian border, as well as where we normally work. Again, they have to say thank you. It's important. That is part of it. Communities showing gratitude, and you accepting that gratitude is really a very important part of all these projects. And the impacts. I think both doctors Levine and Mackler talked about it before, but we had seen this at one point, and you could have knocked me over with a feather when I saw this. This was written in a Christmas letter from a little town called Hondo Valle, which is out by the Haitian border, back to the Diocese of Rockville Center that supported the mission, the parish that was out there. And this is key. We say, what are we doing? We think about, and this is particularly, I want to make this point to those of you who've not done this before and are thinking about doing it. Yes, we are providing service, but what we really are providing is hope. And we are providing hope for the future. There's a word in Spanish called los olvidados, which is the forgotten ones. And if you think about it, even in your life, think about when you were a kid and you were the last person picked for the ball team, or you weren't picked, and that's the thing. And hope is what, and sell is a harsh word, but that in effect is what we're doing. Hope is what we sell here. And this has made it all worthwhile, all the years, all the work, all the everything, and plus, has made it worthwhile. Now, I put this up. A few of you I was very fortunate to have been recognized by the ADA, and I've also been recognized in other ways over the years. But my poor wife, she has enough trouble with me on a good day, and then she has to put up with me in my 20-foot high portrait. And so what my old boss when I was teaching at the University of Maryland would always do, he'd just come by me and go, psst. And that's all he did. Would never say a word, just would do that. And I always got the message. So, volunteering in the age of COVID. It's not going away. There's no question. COVID is not going away. It's interesting. New Zealand has finally figured out that COVID is not going away, so that they're loosening up the country again. It's not going away. So what do we do about it? First of all, you got to be safe. It's not politics. It's common sense. You do what you can do to protect yourself and the participants and the people with whom you'll be working. Number one, get your shots. Don't argue. It's not politics. It's the best we have at the moment. Things are going to change. If you want to argue politics, do it some other time. That's not for this. Go ahead, get your shots. Number two, find out what you need to do to get into a country and also to get back out of the country. And that is critically important, that you do that right. And remember, coming back to the United States, you have to have your COVID test 3 days before you come back. And it's got to be a certain test. Now, fortunately, some of these at-home tests are being accepted, which is great. We went to England a couple of weeks ago where our son lives. We had to get tested before we went. We had to get tested right after we got there, and we had to get tested before we came home. So we got tested 3 times in 7 days. But the other thing is there's paperwork to do. And going to the Dominican Republic, there is a form that we have to fill out before you get to the airport. So make sure that in this age of COVID, and same thing for going to England, you've got to have a passenger locator form that you got to fill out. That's on the uk.gov website. But the reality is you got to know the rules so you go to places, and nobody's going to make an excuse. The last thing you want to do is get stuck. Either you can't go because you didn't do something you should have done, or you can't come home because you didn't do something you should have done, or you got sick. So just be aware of that. We're going to show a couple of slides here at the end on some references. Again, I am sorry because I had a brain freeze. I forgot to change the second one. Remember, this is ADA Foundation, adafoundation.org/international volunteer. It is not that website. You'll never find anything. Remember, adafoundation.org/international volunteer. But the rest of these, I'll leave this up for a second. Take your phone, take a picture of this. This is some of the things that Jack had mentioned. ICD obviously is us, and there's another website, USA-ICD.org is probably our US website. Also, I need to shout out to the international branch of the college for worldwide college for providing our CE for tonight. Steve, both Jack and Steve had mentioned HVO, healthvolunteersusa.org. TravMed.com is a site that has a lot of good travel information, medical information, that kind of thing. And here are all these other things. One thing I'll say about the CDC and the State Department, they scare the heck out of you. You go on their websites and you never do anything. If you read those websites, you would never leave your bedroom. But so just realize, talk to people on site to know really what's going on. And I'm going to finish up here, and I've got a couple of housekeeping things to show at the end. Jack had provided several slides that I'm going to be going through. But remember, volunteering is the most fun you'll ever have working. And I think, can I get a nod from my buddies there? I'm watching, okay, because we're all unanimous again. It's just a great thing to do. And I realize that we're coming up on our time, but you can see, that people are very enthusiastic about the whole thing. So what I'm going to do here is I'm going to stop my share, Kylie, and go back to you, please, if we could, and do what you need to do. Now, the future, there's a lot of things that can be done, but the reality is you still have to do local. You have to be hands-on. You can do diagnostic things from afar, but you still have to be local to do this. When I was teaching at the University of Mississippi, we had this website called Ask the Dentist. And so people would write in all the time, and I would give them hints, but half the time you say, no, you got to go to the dentist. You just have to go. There's nothing else you can do. You just got to go. But yeah, diagnosis we can do. Treatment, the way the treatment works is when you have, say, people with lesser training, and this is what where there is no dentist. So again, it's context, it's local context. You can have health promoters. You can have in Jamaica, they have dental nurses. In other places, they have dental nurses. And as Jack knows from all this time in Jamaica, those dental nurses are pretty sharp people, and they can do basic dentistry, whether it's restorative or extractions or pedo or prevention or those kinds of things. And sometimes what this will do will help. Also for HVO, a lot of things, they've been doing a lot of things remotely while COVID has been, till we figure out what's going on with COVID. Right now, I think all of their travel projects are suspended, but they're doing a lot of telemedicine, teledentistry kinds of things. All right, go to the next slide, please. All right, here again are Jack's suggested readings. I will leave these on here for just a minute. Take your phone, take a picture. I guess we're going to have these are going to be posted on our USA ICD website. But if you want to go ahead and take a picture of this, the package of oral care, which is down at the bottom of the slide. This is what Dr. Mackler was referring to with. I can't remember the two guys' names. Hello, turn on your mic, Steve.
Yo Franken, the art technique.
Okay. All right. And then, so that is there. So that's that. Go to the next slide, please, if you would. And we've all talked about where there is no dentist. The International Dental Volunteer Guide you will find on the ADA Foundation website. Actually, when you get to that website page, that little brown book on the right side is that book that Jack is referring to, and you can click on it and it's a downloadable PDF. And also the late Dr. Martin Hobdell, who has done a lot.
Yeah.
You can't even start to talk about what Martin has done for bringing particularly public health to Vietnam, Cambodia, Thailand, other places that he is. I'm sorry.
Madagascar.
Yeah, at Madagascar, he's done all kinds of things, and it's just great. He did a lot of work with HVO, did a lot of work with the ADA. Just he was as Steve would say, a mensch. He was definitely a mensch, no question about it. All right, next slide, please. Okay, and here's Chris Holmgren article there in the British Dental Journal. Again, take pictures of this. They're also, even though they have a particular bent, the Christian Dental Society has a very good book on, hang on one second. I think I have it on my shelf. Shameless promotion department. This is a book that's put out by the Christian Dental Society, christiandental.org. And this is very, very helpful. And they've got a whole variety of things that you can get. Next slide, please. Oh, back up. If you could back up 1 second. I'm sorry, I just saw that. I also just want to give a shout out to Dr. Judith Lasker. And she, I believe, is in the audience tonight. She's done a lot of work on the medical side. And one of the things, and she's caught some flack, but that's okay. She's a big girl. But the thing is, the question is, how beneficial are these types of projects? And she looked at it more from the medical side than the dental side. But the reality is, and that's why the brochure declaration is really important, that, yeah, these projects are definitely valuable when done in the appropriate way. These are not medical or dental tourism things where, you have to be careful. People, especially younger people, say, oh, yeah, when I pulled gazillion teeth and did this and that. Yeah, but that's not the point. And I think that's one of the things in her book. She talks a lot about I think right-mindedness, I guess is the way to put it. Not that you shouldn't do it, but that you understand where she's coming from and what she's talking about. And I think certainly all of us agree to that. All right, now you have all been very, very nice and patient, and we are in good shape. We've only lost a few people along the way. I want to thank all the rest of you folks who are still with us for hanging in there. And now, of course, this is what you've waited for. You slogged the 2 hours, and God knows what you've been doing. Somebody can give me the score to the Yankees and Red Sox if you would. But the CE information is coming up on the next slide. Okay, so you get 2 hours of CE. And so what you will do is you will get a letter of attendance will be sent to the email that you registered with. And again, we'll thank the Worldwide ICD for doing this, and comes through the Academy of General Dentistry. But, I really want to, Red Sox are up 2-0. Thanks.
Okay.
Thank you. Okay, Red Sox up 2-0. Okay. And I want to thank, again, I want to thank Jack. I want to thank Steve. I want to thank everybody behind the scenes, Paula and everybody else. Now, if you would, don't go away quite yet, please. You're still here. I can tell who the participants are. There's a short survey that we would like you to take. And if you would do that before, it's only like 7 questions, and it's pretty straightforward. So if go to the next slide or whatever has to happen next, if you would. All right. And remember, we basically said, we are not, we do represent the ICD, but our opinions are our own. But as you can tell by listening to the three of us, that. So we're going to end the Zoom. Hold on, everybody. Stay tuned, because the survey will come up next. But I just want to say good night to all of you who came. I want to say good night to my friends, and good night to all the supporters. So thank you, everybody. Have a good night. And hopefully you'll join us one of these days soon. All right, I'm finished.